A HSA is one of the most underutilized accounts for people here in the US. But what exactly is HSA, and should you have one? Let's talk about it. Starting with, what exactly is an HSA? HSA stands for Health Savings Account, and that lets you put aside money for medical expenses. It also provides triple tax advantage. First, contributions are tax deductible or pre-tax through your payroll deductions. Next, the money grows tax-free. And last but not least, withdrawals for qualified medical expenses are also tax-free. Now, you may be asking, well, who can apply for an HSA? In order to have an HSA, you must meet this criteria. You are enrolled in a high deductible health plan, HDHP, usually through your employer. You're not covered by other health insurance. There are some exceptions that apply. You're not enrolled in Medicare. And you're not claimed as a dependent on someone else's tax return. Meaning, if your parents claim you on their tax return, then you can apply for this. Now that we know who can apply for this, how does an HSA actually work? First, you contribute your money. You or your employer can add money to your HSA. The money grows. You can earn interest or even invest these funds. And then you use it tax-free. Withdraw money for qualified medical expenses. Now you may be asking, well, what type of expenses can I actually use this HSA for? Doctor visits and hospital stays, prescription medications, dental and vision care, over-the-counter medications and supplies, mental health counseling. For example, if you have a $1,000 medical bill, you can use your HSA to pay for it. And then you won't owe taxes on that $1,000. I know this is all sounding pretty good, but there are some limitations to how much you can contribute to this account per year. The IRS sets annual contribution limits, which are adjusted for inflation. For 2024, individual coverage, $4,150, family coverage, $8,300. Catch-up contributions, meaning if you're over 55, you can contribute an additional $1,000. Now, maybe asking, well, I'm young, I'm always healthy. What happens if I contribute all this money to this account but never use it? HSA funds don't expire. You can save the money for future medical expenses. And after 65, you can withdraw it for any purpose without penalties. So just to recap, an HSA or health savings account is a powerful way to help you budget and manage your medical expenses. And it helps you save for long term, because any money that you don't use once you hit 65, you can withdraw without any penalties. If you already have an HSA, leave a comment below. And if you have questions or suggestions for future videos, also leave a comment below. And most importantly, don't forget this, learn something new today.